Being an ICU nurse, I see many patients come in with UTIs that led to sepsis. Many patients came in with pneumonia that leads to sepsis and eventually death. So here's what you need to know about sepsis and how to treat it. So what is sepsis? When infection from one organ spreads to the entire body through the bloodstream, it triggers a huge inflammatory response from the body. Our blood vessels dilate, and this leads to a sharp drop in the blood pressure. Our heart starts to compensate by beating really hard, and this leads to multi-system organ failure. So what causes sepsis? Usually a bacterial infection, it could be pneumonia, it could be a UTI, and usually in immunocompromised patients such as elderly, such as patients with HIV or other autoimmune diseases. So when a patient presents with sepsis, we see this picture. They are shivering, they have fever, they have pain, they're pale, cold, clammy, they have shortness of breath, and they are confused. So when a patient presents to the hospital with these symptoms, we initiate labs, such as we check their lactate levels. If lactate levels are above 2, that means there's poor perfusion in the tissues. The tissues are not getting oxygen. Then we send the patient's blood for blood cultures to understand which microbe is causing this infection in the entire body. When managing a patient with sepsis, our focus always is A, B, C's. We want to make sure the patient has a patent airway, that they're breathing and oxygenating their body, and that they have strong pulses and getting perfusion all over the body. And that is our goal, to maintain perfusion in the body, to maintain the oxygen saturation of the patient above 94. Initially, we treat sepsis with broad spectrum antibiotics, and then we take a targeted approach for the specific microbe that needs to be treated after the blood cultures come back. And then we're going to support the patient's blood pressure with IV fluids and with vasopressors. As we're treating the patient, we want to monitor their LOC, their level of consciousness, as they're healing, and we want to monitor if the kidneys have started making urine. When kidneys start making urine, we know that patient is out of the woods, they are starting to heal. And we treat their fever with antipyretics. We want to continue to support the blood pressure, the oxygenation of the body. So this is the whole picture of how we treat a septic patient. If you want more detailed information, comment the word sepsis and my team will send you a detailed PDF on how to treat a septic patient. Good luck.